continue to rise. This comes after the department announced 3 cases at the beginning of February. On Tuesday, the National Institute for Communicable Diseases, NICD, confirmed that the 6th cholera case had been identified in the country.
All the cases are concentrated in Gauteng and are adults between the ages of 19 and 44 years old. Cholera is a bacterial disease causing severe diarrhea and dehydration, usually spread in water. The department has also urged the public to practice good hygiene to minimize the spread of the disease. Joining us this morning from Pretoria, South Africa, as a member of South African Medical Association, Dr. Angelique Coetzee. She joins us this morning to talk more about this. Good morning and thank you very much for joining us.
Good morning and a good morning to all your viewers and listeners out there.
All right, Dr. Angelique, talk to us about these cholera cases. Why do we have them springing up, especially in Gauteng?
Okay, so first of all, let me just say that the World Health Organization defines an outbreak by the occurrence of at least one confirmed case of cholera with evidence of local transmission in an area where you normally will not see cholera. I think it's important. So yes, we've got an outbreak, although it's only 6 patients, but this is according, or 6 persons, this is according to the World Health Organization definition. Very important is there should be track and tracing in those areas. As again, they're not known to have cholera before. Cholera is not something that we really see in South Africa. This is new to us. In case of in the sense of an outbreak, we also need to understand that the most important thing with cholera is sanitation and water. So if we don't have safe water and good adequate sanitation, you might be able then to, if there's a case that then contaminate the water, might spread it going forward.
Okay, well, obviously, now you've mentioned water, would you say that these are maybe because of the country's water sanitation problems? Is South Africa currently dealing with issues concerning the purity of the water that is being supplied to citizens?
So we do have a challenge because of the rolling blackouts that we get from Eskom on a daily basis. Unfortunately, if these some of these municipalities are being affected by these rolling blackouts and not being able then to get their sanitation systems going, or even struggling with the water, it might lead that. I'm not saying this is because of that, but this might be a possibility. And then again, drinking water of the communities. There was lots of rains now currently in South Africa. So, if you wash in the rivers and dams that might be contaminated from someone else, you can spread it. So it's always safe to drink water from a dam or a river by boiling the water. Also remember, even if you don't drink the water, and if you also know that your municipality is struggling with sanitation and safe water, it's always better then, again, to boil the water. But even the washing of your fruit or your vegetables might lead, with contaminated water, might lead you to be exposed to cholera.
I mean, it's a really dire situation that we're seeing here. We're talking about some communities dealing with water issues. There's also the issue of load shedding. You're saying to them that they have to boil their water. And, some of the concerns that might be raised would be how to be able to achieve this, especially is because South Africa is currently having issues with power. Let's talk about the Department of Health. What are they doing currently to combat this epidemic? Or this? Can we refer to this as an epidemic yet? And what are they doing to combat this?
At this stage, it's still an outbreak. We cannot say it's a pandemic or an epidemic. As again, South Africa is not one of those countries that will fall under that. So what the National Department of Health is doing, they're trying to run a campaign where they advise people to boil their water, to wash their hands, and to make sure that if you are in contact with someone, that again, you take precautionary measurements. Also very important to understand that even if you take the precautionary measurements, you don't boil your own water in an area where there's an outbreak, as per the definition, remember, one person needs to be seen as an outbreak. You might unfortunately also be part of it. And then important is also to understand that anything, you can be contaminated or you can get the bacteria, and within 12 hours until 5 days later, you can only get symptoms. So you don't need to get it this morning and by this afternoon you're very sick. Less than 1 out of 10 people will get severe diarrhea. A lot of people will have the diarrhea and doesn't even know that they have cholera. That's the other problem that you are sitting with. And then you might still, 10 days after you have been recovered, you must still find some bacteria in your stool. So it's always, you need to go and see who is acutely ill to make the diagnosis that they are currently having it, or if they are recovered and you still get some cholera in the stools, you need to know that's post-cholera. But again, that stools that's got some cholera bacteria in it can also affect other people.
So at what point should people who suspect that they might have diarrhea, at what point should they visit the hospital or a healthcare provider?
So, as I've said, not each and every person knows that they have diarrhea or that they have cholera. They might just have very, very mild symptoms. But I think what is important is to start to understand that the moment when you start to get dehydrated, you have profuse watery diarrhea. We sometimes call it rice water diarrhea. If you have that, vomiting, they can't keep anything down, and they have this excessive thirst and leg cramps. They can become very restless and irritable. Those are the people that really, really need to get to hospital or a local clinic as soon as possible, where they can be treated with rehydration as well as an appropriate antibiotic to try to resolve the symptoms. Unfortunately, if you are one of those, one out of 10 person that gets the severe diarrhea and you don't get in time at the hospital, or the diagnosis is being delayed, you might unfortunately die. But again, as I've said, the good news is most of the people won't even know that they have diarrhea or experiencing severe symptoms of not feeling well.
All right. I also want to talk about, because you've talked about fecal-oral transmission and making sure that water isn't contaminated with stool. Does South Africa have a public defecation problem?
Well, I can't say at this stage, yes, that we do have a problem. We have challenges. Unfortunately, we also don't have the vaccine. So if there's an outbreak in a certain community, we currently, there's no stock of the vaccines in South Africa. It's difficult. Worldwide, there's not enough stock, so they are ransoming the stock because there's some countries in Africa that are cholera is endemic to, and that would get more prevalence or more, they will be first in line to get some of these vaccines. But for now, we do have a challenge with the vaccines as well.
Right. Unfortunate incidents of 6 cases of cholera announced in Gauteng in South Africa, with 1 death being that of a 24-year-old man. And we're encouraging that people should, as much as possible, be clean, wash your hands and take all the precautionary measures. Thank you very much, Dr. Angelique Coetzee, for joining us this morning. And we do hope to see that this is brought under control very quickly before things spread out of control.
Thank you so much.
Thank you. Do enjoy the rest of your day.